I love Naples. I love Collier County. And over the course of my many years here, I've had the incredible experience to understand what makes us the best place in America to live. And let me tell you, it's not just our beaches. Far from it, actually. It's our people, and it's our partnerships. And none of it's happened by accident. I've seen it time and time again. The more people learn about what's happening in our community, the more they come to the realization, this is not happening where I come from. Collier is special. Collier is unique. That's why I'm bringing you Community Matters. Think of this as your Collier County 101. I'm your guide, introducing you to the people and the resources that I think that you should know through short, real conversations so that you feel more empowered and ready to engage in ways that will positively impact your life, your family, your careers, and this beautiful place that we get to call home. Because community matters. Hi, I'm Amanda Pearson and welcome to Community Matters. I'm thrilled to introduce to you today Scott Burgess, CEO of DLC Behavioral Health Centers. Welcome, Scott.
Thank you so much. It's an honor to be here.
I am incredibly honored to have you. I want first to start off with a little bit about you so people can get to know you. So you have been the CEO of the David Lawrence Centers for 11 years.
Yes.
Over a decade now. We're so grateful to have you. The DLC has now grown to be around just under 400 staff. Is that right?
Yeah.
What I find super fascinating is that you began as a counselor and you are still to this day, while CEO, you're still a licensed clinical professional counselor.
That's true.
I think that's pretty unique.
Yeah. I have had a passion for this field almost my whole life, and I still love to learn about the field. It's a constantly evolving field, so I love keeping that counseling license.
I think the DLC is blessed to have a leader who has that. So that's pretty spectacular. Of course, you have a bachelor's and master's, but you've also attended Harvard Business School Executive Education Program, and you've received the Notre Dame Executive Certificate in Leadership. And then some of your accomplishments, the way you've been recognized in this community, you've been selected as Man of the Year in 2018, very deserving. You were recognized by Naples Illustrated in 2020 through 23 as one of Collier's top 100 most influential business leaders, very deserving. You're on a lot of boards with the director of the Florida Behavioral Health Association, Circuit 20 Regional Council for Central Florida Behavioral Health Network. You're a board member of the Greater Naples Chamber. You serve as the Collier County Chair of the Collier's Mental Health Strategic Planning Commission, which is a pretty neat initiative. But also you have a wife, you have 3 children, 15 years as a youth coach, and you are active and volunteering in various ministry efforts too, which I find so endearing.
Yeah. Thank you. Yeah. I enjoy all of those things, and it's passion on my heart, and I try to follow it wherever I'm led. So.
Well, we're grateful for that. So how about a fun fact that people wouldn't find in your biography? What can you tell the listeners today?
Well, a fun fact might be that my daughter, who's my youngest, when her whole life since she was 12 years old, kept saying every year that she wanted to skydive. And I told her that she had to wait until she was 18 years old to be an adult to make that decision. And she said the caveat is that she wanted to skydive with me. So I kept saying every year, well, let's see how it goes. And I kept thinking, well, she got closer and closer, she wouldn't want to do it. And on her 18th birthday, she said, Dad, remember, we got to go skydiving. So we did that together. So that was something people might not know about me.
Brave. So you are brave. I'm not sure I would ever do that. So congratulations on that. I'm going to also offer up another fun fact about you, that you are a wicked bowler.
I grew up bowling. I love bowling. I come from a family of bowlers. My brother actually, I think, has 9 perfect games. My dad has, I think, 3. So I'm not in their class, but I can do it.
I've seen it in action, and watch out, people. So let's get to the topic of the David Lawrence Centers and mental and behavioral health. So I wanted to start off with some of the data about mental health and wellness. And I believe the statistic is around 1 in 4 are impacted by this, which to me comes off as about one household. And in every household, I feel that most people can relate to this topic, right, in this issue. So what does some of the data tell us about that?
Yeah, well, the data's been pretty consistent, and especially with COVID and some of the other challenges that we've gone through recently, we've seen about 1 in 4 are directly impacted with a mental health challenge in their lifetime. So, of course, like you said, in a household, if one person's struggling, everybody's struggling, right? So, mental health has an implication or impact on pretty much every family. 1 in 7 are going to struggle with a substance use disorder challenge. So that is another area where most people are touched, whether it's themselves personally, a close family member, a close friend. We've all had experiences where has some sort of direct impact to us.
Absolutely. So when it comes to funding this work of what the David Lawrence Center does, and we are going to talk a little bit more about that. How is the David Lawrence Center funded? What is needed in order to address this? It's a huge population of people in need of these services.
Yeah, and it's a growing need. So not only are we seeing the prevalence increase around the need, and year over year, it seems like more and more people are having the need. We're having more and more people that are coming to Southwest Florida and Collier County. So we've got this kind of double impact of what's driving the growth and demand and the growth and need. So to that end, we do have what we call a braided or blended funding stream. We don't get all of our resources from any one area, but it's multiple areas. So we are able to accept if somebody has Medicaid or Medicare or private insurance that helps support the services that we provide. But the vast majority of folks that come to us at DLC are either uninsured or what we call underinsured, so they don't really have anything or much of anything as far as resources to support their services. So that's where a number of our other efforts go into it, where we're trying to secure funding from the state, secure funding from the federal government wherever possible. The local Collier County government provides some support. And then there's still a gap, and that's where our fundraising efforts really come into place. So that we really need to link arms as a village. It takes a whole village to do what we do and to keep growing to meet that demand. Another thing that's really important for people to understand is that we don't turn anybody away at DLC. So we've had like a long history in town. One of the older not-for-profits in town, we started in 1968. And our commitment has been since day one and is to today that we won't turn anybody away, regardless of their ability to pay or not. So we have a sliding scale. That's based on a person's income. So if they have a very low income, they might pay $2 to see the doctor. They might pay $5 to see a therapist because that's really all that they can afford to contribute to that effort. But that puts the pressure to make sure that we're securing the resources in other ways to not only sustain what we're doing, but grow and meet the need of a growing community.
That's critical, and I really applaud DLC's work to provide access to everybody. That's tremendous, and I'm not sure if that's happening around the nation the way it is happening here.
I mean, the intention when they built community mental health centers all across the country, across the last several decades, was to have that in every community. But unfortunately, that's a reality that just has not been realized. We're very fortunate and blessed in Collier County, specifically because of the great people we have in Collier County that are so generous and willing to support these types of efforts, knowing that if they don't do it and that they don't step up, people struggle. And in the reality of what we do, it's not only that people struggle, sometimes people will lose their life to the struggle. And you mentioned statistics. Suicide is the second leading cause of death for kids in our country. So when you think about charging the hill, in a community, in a society, you want to do that for your kids in every way, shape, and form, and that's a major issue.
I get teary-eyed. It's a serious issue. It's what a terrible statistic. Awful. And I have to. And in my intro to this podcast, I say, Collier's special, Collier's unique, and or this isn't happening where I come from. And I think about where I grew up. I can't tell you who was addressing this work like the David Lawrence Center is in our community, which is really special. So thank you again for your work.
All right.
So knowing all of this, the data that you just discussed, what it is, how is the David Lawrence Center? I find the creation of David Lawrence Center really fascinating, how it started. who is David Lawrence, and what type of services are provided. And let me tell you, I've been learning about the services that DLC has been providing recently, and there is a plethora, 45 plus, which we won't be able to get to today, but there's a lot. So how was it started? Who's David Lawrence, and what is DLC providing?
So we're super blessed with our history of Polly Keller, who is the founder of David Lawrence Center. She was living in the community when deinstitutionalization in the country started, which was put into place by John F. Kennedy. And she was so passionate about mental health because she actually, back in the days where there were large psychiatric hospitals, the staff members would live on those campuses as well. And Polly's dad was the chief psychiatrist of one of those large state hospital campuses. So she actually lived growing up on a psychiatric hospital campus for a large state. And so she came to realize that these were individuals just like anybody else, that they had some unique healthcare challenges, but when those things were taken care of, they could do well and thrive. So when the idea of deinstitutionalization came, and we were trying to get everybody back into communities to live back with their families and their friends and the communities where they grew up, she said, we have to do that right here in Collier County. So she got a small band of friends together, and that's how it all got started. And a big inflection point happened for the organization when Doug and Mercy Bathy, they had lost their son to the struggles around mental health, and they heard what Polly was trying to do. They contributed enough money to get the 10-acre campus that we're on and the money to build the first building on our campus. So we renamed the organization. It was not originally called David Lawrence Center. We called it David Lawrence Center because their son's name was David Lawrence Bathy.
You know, it's a touching story, to say the least, and it again shows when it took community members with an idea, with a passion, with a sense of giving to make it all happen. And wow, look where it is today. So what, it's always hard to describe, tell us all about all of the services that's been happening in 2 minutes, but what can people expect from what's happening on campus, off campus, all around? There's so much.
Sure. I know it's a lot to digest, and I think the easiest way to kind of describe it is that we provide behavioral health services. So that means mental health related services and substance use disorder related services. And many people have both of those issues, and we can treat those as co-occurring illnesses or challenges that people are struggling with. And then we take care of the whole age spectrum. So we work with young children all the way through senior citizens and you name it, all the way in between. And then from a continuum of care standpoint, we really can provide it all through David Lawrence Center under kind of one umbrella. So we have 24-hour crisis care, inpatient units. If somebody has a significant mental health challenge, we provide the inpatient psychiatric care for children and adults. We have 28-day program for residential rehab and detox. Those are high-intensity services. So that's really the high-intensity services that we provide 24/7, 365. We never close, even during hurricanes. And then we've got outpatient services. Those are the typical things that people would understand, where you come and you go. You visit with a doctor, maybe medication management. You visit with a counselor once a week or once every other week. And then we've got a lot of community-based programs that we're going into homes, working with children that are struggling, and we're helping them understand their challenges better, how they can cope with those. We're educating moms and dads and grandparents and siblings around those as well, because as much as the individual, the child is struggling, the family's struggling as well. So we go into the homes, we work with kids and families. And then we do that also for adults that have serious persistent mental illness. They have really serious challenges with maybe severe schizophrenia or bipolar disorder or other types of conditions where they really need to have somebody that's helping them thrive in the community. So we'll even help get them to the doctor, to get their medicine, to take care of getting their groceries, those types of things that are going to help them, not only survive in the community, but then really thrive.
It's amazing to me. I can't believe, as I'm continuing to learn about the David Lawrence Centers, you have the spectrum. I'm kind of seeing it as from prevention and education. So how do we prevent, getting to a certain place? Even you've got some workplace wellness programs happening and things like so. Prevention and education, all the way down to, of course, that crisis intervention, but also you have angels of staff that are driving to people's homes 2 to 3 times a day to make sure that they're, able to take their medicine and they're eating. And it's really unbelievable work that the wide spectrum of that the David Lawrence Center is doing for our community. I'm
Thank you.
so impressed.
Thank you very much. Yeah, we are indeed blessed. We've got amazing staff that this is really more than a job for them. It's really a mission, it's a calling, and you can really feel that. I talk a lot about the fact that we provide treatment at David Lawrence Center, but really, more importantly, we provide care.
Oh, yeah.
And that's all from the heart.
Your staff is so passionate. So how about let's get to the last 3 items. I wanted to talk about partnerships, the future, and how to engage. So can you briefly share a little bit about partnerships? I know I know a little bit. You've partnering with the school system, with the sheriff's office, and so on and so on and so on. What kind of partnerships exist in order to treat, how to help those agencies succeed, or how to help other nonprofits amplify their work? Because the DLC is partnered with so many nonprofits and agencies in our community.
Yeah, we actually have a graphic that was put together by the Board of County Commissioners because at one point they were trying to really wrap their head around how this all works in our community. And we called it the hub and the wheel. So the way that the graphic looks is all of these partner organizations, which we're blessed to work with, but DLC's kind of been the hub of the wheel. We're in the center that we receive a lot of referrals from those places. And we work in partnership with them because we can't do everything either. So we get individuals that are referred to us from the hospitals. We get referrals from the sheriff's office. We get referrals from the school system. We get referrals from the other community partners out there, whether it's the Shelter for Abused Women or it's Warrior Homes or those types of organizations. And it all has to come together in a partnership and a collaboration whereby we're there to help with the behavioral health needs, but then we need to partner with those individuals to provide some of the other care and support. So it really is an absolute collaboration. And that is another thing that's very special about Collier County versus other places in the country where that collaboration doesn't happen and you hear the phrase people fall through the cracks.
Right.
And we don't allow that to happen in Collier County. We work together to make sure that individuals are getting the care that they need in the right place at the right time with the right organization. And we're blessed to be kind of that hub in the wheel.
I would 100% agree. And I also, am I right in that the David Lawrence Center is responsible for, can you share a little bit about how you work to train law enforcement officers? And
Sure.
that's a special training that I think is pretty neat as well.
Yeah, that's a partnership, with NAMI and David Lawrence Center and Collier County Sheriff's Office, and we're also training people that are in the judiciary. So it's CIT, and that it started out in Nashville, and really what it is it's an evidence-based best practice to have law enforcement better understand mental illness and substance use disorder. So now we're not trying to train them all to be therapists or mental health providers, but how can they respond to a call in a way that's sensitive to understanding what might be more effective with those particular issues. And it's all about de-escalation and trying to learn how to do things maybe a little bit differently than maybe they were trained in the academy because this is a unique circumstance. And so that takes a huge commitment from the sheriff, and we're blessed to have Sheriff Rambosk in Collier County who understands how critically important that is and has committed to having all of his officers go through that training. So we're constantly having new batches of new deputies and officers that are coming through the training. And our partners with NAMI and the sheriff, we all work together to make sure that happens.
That's a huge blessing. So to finish up here, our population is growing. The need is growing. What can we hope to expect for the future of the David Lawrence Center's growth to address this very clearly growing need?
Yeah, it's really it's unprecedented growth that we have seen that we're in right now. It is a crisis unlike we've ever seen before as far as the growth, and we anticipate that that's going to continue because we've had major growth in the area. Not to mention things that are happening in the community related to like fentanyl and how severely addictive that is, and we're losing more Americans to fentanyl overdose every year than what we lost in Afghanistan, Iraq, and Vietnam wars combined in 1 year just to the fentanyl overdoses. So we know that this is a growing issue and it will continue to grow. So we created a comprehensive campaign called Hope for Collier, and Stronger Minds Together. And this is basically our vision that we're trying to realize and live into with our community, locking arms with our neighbors in our community to expand physical capacity. So we've got some new buildings that would expand in order for us to provide more support, obviously more services for the people that are needing those services that continue to grow. Really leaning into having best in class staff members and being able to pay them a wonderful compensation, because it's costly to live in Collier County as well. The affordable housing is a big challenge.
So little.
Yeah. So all of that together is going to allow us to be able to not only attend to the needs that we know are here now and in the short run, but for really decades to come. That's our vision.
So if people don't want to engage after hearing this, then I don't know what. But tell me, can you please share with everyone who's listening? They're excited maybe about the work that the DLC is doing. They want to engage. What are some of those first steps to get engaged with the David Lawrence Center's efforts?
Absolutely. Well, we certainly love the opportunity to be here, to be able to amplify the message, to raise awareness and try to continue to decrease stigma.
Yeah.
So what we encourage people to do is if they're passionate about what we're trying to do and they want to lock arms with us, we'd love to have them come out for a visit. So I think it's very different what the media maybe historically has portrayed mental health institutions or mental health organizations. And then when you come out to our campus and you see how beautiful it is and therapeutic and the big, huge banyan tree, it gives a complete different sense to the therapeutic environment that we have there. But then it's another way for us to give a little bit more in-depth information to folks to see what they might have as an interest. I also encourage people to go to our website, so dlcenters.org. Another great place for them to just learn a little bit more about us. And we've got some videos and other information that might be helpful for them if they're going through something or their family members are going through something. It's a great way to connect. And then we do have, social media channels, which is another great way, so you can look up David Lawrence Centers on, Facebook or LinkedIn or things like that. It's a great way that we push information out that might be helpful tools and tips. Maybe it's what's going on at DLC, all those types of things.
I'm confident that anyone who contacts the DLC, whether they're looking for something with their business, whether they're looking for something for their family, whether they want to engage some way personally through an event or something, they will find it. And I hope that our listeners will do that. I just want to thank you so much for your time. I find you to be an angel of a human being, and we are blessed to have you in this community.
Thank you. It's been a privilege, and ditto to you.
Thank you so much. And I hope our listeners today will find some way to engage, because community matters.
Okay, well, thank you very much for sticking around to the end of the podcast. And as promised, for your viewing pleasure, I will now juggle. I am not a juggler, but I'm going to do my best. And I started with these that are nice, lightweight, and soft versus chainsaws as my first attempt. So here we go. Not too bad.